Hello, I'm delighted to invite you to an insightful webinar co-hosted by the Copenhagen Institute for Future Studies and the WHO Regional Office for Europe. This webinar, How Can the Nordic Approach Prepare European Health Systems for Equitable Digital Futures for All, is based on our work with Nordic Health 2030. I'm Boje Eliassen, I'm Director of Health at the Copenhagen Institute for Future Studies and also the initiator of Nordic Health 2030. I would also like to thank WHO and Clayton Hamilton for making this webinar possible. So, Nordic Health 2030 is really about imagining what we want. It's also about thinking about how do we get there, so moving from what to how. So how do we work on a better future together to reach better outcomes, not just for society, but also for each one of you? It's really about purpose and objectives and about helping everyone and moving the many a bit. When we work with health in this way, it's about communities, it's about putting compassion and solidarity into the center, and of course, really about dignity. When we did our first round of Nordic Health 2030 in 2019, we put in 5 values: creativity and innovation, trust, openness, individual responsibility, and cultivation, so the ability to work with knowledge. Today we are going to discuss in 3 rounds in a panel on the macro perspective, on Nordic practical challenges and solutions, and connecting Nordic data and values to advance Europe. These are really meant as inspiration and tools for advancing our way of working with digital health. And we should also here think about that health is not just about getting access to a system when you need it, but also about preventing so you don't need it always. But we should also be proud. We have lifted our lifespan on average the last 150 years from 30 to 70 or 80 years. But the later years has also shown that we have a huge disease burden in chronic diseases or the non-communicable diseases, where we spend too much time in ill health. So the chronic diseases are responsible for about 74% of deaths globally, 87% in the northern part of Europe. And here we are thinking mainly about cancer and cardiovascular and also respiratory diseases like COPD that we have worked quite a lot with lately. So this is also about moving from lifespan to health span, from access to care to access to health and healthy living. So it's really about acting earlier, ensuring timely and precise diagnosis, as well as early and precise intervention to keep people as healthy as possible for as long as possible. So it's not a binary ill or healthy. It's really thinking about how can you be as healthy as possible during your lifespan. This comes back to Leroy Hood's old notion of P4 approach to health, so predictive, preventive, personalized, and participatory. We call it P5 because we put the purpose in as well. And here in the Nordic Health setting, we are really thinking about how can we help the person also to use data on themselves, about themselves in a participatory way, what we have called the humanome model. And this is also a part of pushing forward, as WHO also does with the well-being economy, but also self-care parts of it. It's also about a sustainability model on how do we use data together across different jurisdictions, organizations, and countries, so we actually learn and can use it better. And this is very much in line with WHO's definition on health as a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. We also see the 4th industrial revolution that was coined a decade ago or a bit more, with working with data and digital functions, new biology or genomics, imaging, smart materials such as nanotech. And now we are beginning to see that we move from the focus on the technology per se to providing value with that technology. So that's what we call the 5th industrial revolution. And here it's clear that we need clear vision and purpose, or as we also say, if you don't know where you're going, any road will take you there. So it's about seeing health as an investment, as a foundation for equity and equality, for fairness and sustainable growth in society, but also for the resilience and prosperity in the future and future generations. So the core here is really sustainable efforts. We also need to reduce carbon footprints in health, so we also need solutions in that way, minimizing waste, and also to, of course, use resources much more efficiently. But in the end, this is really about reducing avoidable disease burden that we estimate in the chronic diseases to be around 30%. So how do we keep people healthier for longer with being smarter with using what we already have? In order to do that, we also need to focus on dignity for each and everyone, equity at the core, and it's about a social contract that can grasp the analog and the digital world at the same time. We have fantastic technology and knowledge to do much better. So how do we do the right things right? How do we apply what we already have and not just think about the innovation on what might come? So there are 5 pillars here. It's about improved technology and making that used and usable, enhanced prevention, better treatments, greater dignity and equity, and increased sustainability, both for the environment, but also on the resources on the system, so we have the resources to help the many. So with these words, we go on to the first panel. So with me here in the panel, I have Lars Munter, who's founder and international director of the Nordic Wellbeing Academy. I have Clayton Hamilton, who's the regional technical officer of Data and Digital Health of WHO's regional office in Europe. And online with us, we have Mette Maria Schødt, who is Chief Administrative Officer at the Odense University Hospital in Denmark. And also Erik Sutherland, Senior Health Economist of OECD, the Organization for Economic Cooperation and Development. Welcome to all of you. So if we now start with you, Lars, you have quite some experience in working with community health and well-being programs. So what is the role of these kinds of programs in a Nordic setting?
Well, in a European or global setting, community health is often sort of reduced to the geographical element of systems providing certain services for a community. And then you would, of course, think about how you can improve that. In the Nordics, it's more or less not just about the geographical community, but the various different types of communities that we're in. And it's about process and people. And the participatory process is then that we try to build a lot of different community health services in collaborative partnerships where you use tools of respect and dignity and certainly also trust. That path is one that requires a lot more engagement and inspiration, and is one that's really tricky to also use if you insist on command and control methods.
And can you just shortly give one example?
Well, shortly one. In Denmark, the region of Zealand are exploring on how to get specific municipalities to work better on innovation with the local both hospital, but also GPs and civil society. It's a, if you will, messy process, but it's extremely effective also.
Okay, very good, thank you. And now we go online to Mette Maria Schødt, the Chief Administrative Officer of the University Hospital in Denmark. So welcome, Mette Maria. Happy to have you there online. So you have been involved in practical use of digital health for many years, and you're also involved in organizations in this area, global organizations in this area. So why is it we should work Nordic? And what are the specific success factors we could inspire with in the rest of Europe?
Yes, so that's very good questions. So I think what we see in the Nordic countries is that in between the countries, we actually have the same focus areas and the same goals with respect to healthcare. We see more focus now on prevention. We see more focus on treatment in patients' own home. And we see a huge focus on a closer collaboration between the sectors, between the different municipalities and regions. And I think that's quite common in the Nordic countries. And many of our digital solutions are used as tools in these transitions. And that goes for all of the countries. So, of course, it makes sense to collaborate close in that area. All of the countries in the Nordic has a quite long experience in the development and also implementation of digital solutions. And I think one of the examples that we see across nations is the portal for patient communication that almost all of the countries have, but all of the countries has their own kind of version of it. And but it says something about we are in the same direction, and this is also some of the ideas that you can spread out wider than the Nordics. I think one of the things that are very common for the Nordic countries is that we have this holistic approach, both with respect to healthcare, but also with respect to the solutions that we provide for our patients. So we like to involve the patients, we like to involve the clinicians whenever we do solutions. We like to collaborate between public and private partners. And this is both on organizational level, but also on the local levels. And I think that's some of the things that make us really strong in the Nordics, but also some of the things that could make us even stronger.
Okay, thank you so much. And now, Clayton, I would also call you my co-host today.
Thank you.
So you have been working with digital health in Europe and also been involved in the Nordic Health 2030. So how do you think these concepts can help in pushing digital health forward in Europe?
Thank you. So firstly, I think it's important that we started looking at the fact that the Nordic Health 2030 initiative really articulates a view of health that's very much in line with the United Nations and WHO's vision of health. And in particular, what it does is it draws attention and underpins this notion that health has very strong linkages between social cohesion and economic prosperity. So it's very much not just healthcare, as we often talk about, but it's about the societal role and the benefit of having healthy communities, healthy populations. But in particular, the Nordic Health 2030 initiative focuses on three things that I think have great relevance for Europe. So the first one, and you touched upon it a little bit in your introduction, is really the need for us as European countries to pivot our healthcare from reactive models of care to models of disease prevention and predictive models of health. And really to understand very concretely what is the role of digital in that transition. So that really gets into that discussion. The second is it meets head on the need for us in digital environments to address inequity, protect gender and human rights. And this is a very, very important point that we really want to enshrine in all digital transformations within Europe. And that is that we want to be careful we don't exclude or marginalize the people that we're trying most to serve through digital solutions. And finally, and actually quite refreshingly, the initiative actually challenges us. So it actually asks us to embark upon new thinking around social constructs for health data to drive deployment of digital public goods which benefit everyone. We know that only 35% of the 53 countries in our region have any form of policy or strategy guiding data analytics and data use within their health systems. This is something that we really need to change and something where we believe that the Nordics are perhaps a little bit ahead of.
Thank you. So, and with that, we go to Eric Sutherland, the Senior Health Economist from OECD, who's with us online. Welcome, Eric.
Welcome.
Thank you.
How are you?
Thank you for joining. So you have developed a framework for health policy that we also are thinking about pushing forward in the Nordics and develop furthermore. So can you explain why we need that and what is it we want to get out of this?
Pleasure. This has been something that has been important to me for some time since I joined the OECD a little while ago. As I reflect on the work that we want to do, the whole vision that you were just talking about, and when I look at it through the lens of data and digitalization of health systems, all of those things of prevention, prediction, communication, and actual ultimately to the point of empowerment of individuals in their own care relies upon timely access to data that people can actually use. And for that reason, like many years ago, the OECD created our so-called health data or recommendation on health data governance, which really talked about the need to provide that timely access to data with the appropriate protections in place, but emphasizing that access is the action that actually drives better health outcomes for people, and in providing that access, making sure that it is appropriately protected. Having lived with that for some time and having observed many countries, we really realized that the data that has been created in the last 20 years has been massively fragmented. And when I thought through that, I realized that the reason why the data is fragmented is not because, well, it is partly because we made individual procurement decisions, but it's because there were no incentives. There was no policy that actually prioritized ensuring the data was coherent and usable and going to be available on a timely basis for purposes of individual care or purposes of secondary use. And so in many ways, while we have data fragmentation, it's a result of policy fragmentation. And that policy fragmentation is because frameworks were created across how do we manage technologies, how do we manage data, or how do we manage analytics. And those sets of policies were developed in those individual silos, and then moments of tension would occur between them. Easiest example of that is we talk about policy secondary use and the emerging area of artificial intelligence, which obviously wants to maximize the amount of data with as much granularity as possible. And yet our privacy and access regimes are all about how do we minimize data in order to actually minimize the risk of privacy. And so these two areas are very much in tension with each other, and that tension needs to be reconciled. And so that was really the inspiration underpinning pulling together a coherent framework and a comprehensive framework across all of those policy areas. So we've reviewed more than 20 different frameworks and really narrowed in that there is a set of policies related to analytics, a set of policies related to data and data management, a set of policies related to technology, and crucially, a set of policies related to the human factors that hold the whole system together. And so the simple analogy that I use, and that is you need to build the pipes, which are the technology. You need to foster the water, which is the data. You need to have the taps in order to get the insights out of the system. And you need to have the people, the plumbers, that actually design and build the whole system together with the appropriate quality control mechanisms. And so what we've done is we've built that framework. We published a picture of what that looked like in Health at a Glance 2023 last year, and we're on the precipice now and been working closely with BOE and the Nordics about how do we actually turn that area of 24 policy areas into practical advice that policymakers can use to actually understand what their policy footprints need to look forward.
Okay, thank you so much, Eric, on that. And back to you, Lars. So we have now with the four persons, so you are more in the community, and Clayton is on WHO, and we have Met Maria, who sits in a hospital and works, and then we have Eric on a more overarching part. But all of this is about collaboration. So from your point of view here, what you are working with, what is the most important in order to push forward, connect to these parts, but from your point of view to push forward?
Well, two elements. One, on the kudos to Eric for a wonderful metaphor, and I really like it. But to connecting to Clayton's idea about the need for digital strategies, and I certainly agree with you totally. When you then want to build a new building code that would allow this to happen, that the policymakers can hire all these plumbers and install all those pipes, the strategy to do that has to be built in a collaborative space. Mm-hmm. If it's to avoid digital dictatorships, digital feudalism, digital hyper-commercialism, you need to have the strategy to be built in a collaborative space. Mm-hmm. It's one of the only ways where you can have trust at the center of that new strategy, so that people actually appreciate that you install new pipes in your house and that there's plumbers running around, and you do not repeat inequities. Mm-hmm. if you will. We ensure that the pipes are actually available for everyone, and that the plumbers will actually go and fix your pipes wherever you live. But building that strategy in a cohesive space is really important. So when we advise membership countries on how to build the strategies, it's about making sure that you have all the people in the room at that time.
So Clayton, I think you are very natural to take over here, because you are a part of activating member states, working with member states, advising member states, listening to their needs. So what is it, where is it WHO really can push this, and what is it you also need from other partners?
Fantastic question. So continuing on from your analogy, Lars, I think having the digital health strategies in place are absolutely pivotal, but they're one step. And I think it's also important to acknowledge the fact, and this is what countries, I think, very honestly struggle with, is the notion of how you govern the investments and finance investments for digitalization. And it is a big word that can be interpreted in many ways, but essentially when it really comes down to it, we're looking for very qualified management that actually is values-based, so it ensures that those values are inherent in the systems, but that really governments are leveraging the value of the investments that they make for the best possible output for citizens and the best possible health comfort they can get. So what can WHO do in this picture, and what are we asking for? So essentially, more and more, and Eric was also very much clear in pointing it out, that data has become the fuel, which is really generating a lot of the insights and a lot of the necessary transformations that we're very much looking forward to as we look to the future of what health can and should become. But managing those data environments are very difficult. We know that the European Commission has recently now approved the European Health Data Space Regulation, and this is a huge quantum leap forward in terms of how we manage those environments. So what WHO is really looking for is cohesion across member states in terms of, firstly, recognising the need for the policy and political level to engage and support. And we know that realistically that support isn't always there for digital transformation. It's for those people working in it, can be really a struggle to climb that hill and ensure they have the political backing. And the second thing really is for us to agree collectively on a set of informatics standards that will allow health information to be exchanged both domestically and across borders.
And you have also pushed the Strategic Partnership Initiative for Data and Digital Health at the WHO. I must say I'm also involved in that. So
disclaimer.
Disclaimer, but I think so there is also the private-public partnership angle in this.
Very much so, and I think we would all recognise that, very briefly, that when you've worked in this space long enough, you really do understand that there are many different individuals working between public and private, focused on what they perceive to be digital health, that maybe aren't always linking into exactly the needs the populations have. So the Strategic Partners Initiative for Data and Digital Health, or SPI-DDH, as we call it, is really a multi-stakeholder platform that the member states of Europe has asked WHO to set up and run in order to really tackle the key points and key challenges that countries are facing in digital transformation. So the countries, and this is a network or a platform for countries, the results go back to countries, and the countries are prioritising and leading this work. And no surprise, the topics that have come out are artificial intelligence, responsible AI, looking at healthcare and prevention in the home, standards and interoperability, and mental health and health workforce. So it's really an opportunity for us to ensure we are getting to the key problems to facilitate progress in countries.
Thank you so much. And now going back to Mette Maria. So you sit in a hospital and you have worked very much with the digital part. You were also a nurse, so you are the one closest to the person with new tools. And one of the aspects that Clayton was mentioning was the health at home, where we need digital tools. And I know this is something that you also have been working with. Can you elaborate a bit on that part?
Yes, so of course, being a nurse, I'm very happy about this question. And one of the things that we see is that digital transformation is one of the great hopes for the healthcare system. And we need to bring all these strategies alive. And in the middle of all this, we have the nurses. And they have a huge strength. They know the healthcare system in all corners. They're kind of the glue that links the healthcare system together. they make everyday life work. And they're also the group in healthcare with the highest degree of direct contact to patients and citizens. So talking about hospital or at home or care at home, one of the big things is the whole area around communication. And this is where the nurses stand very strong to make communications and tailor the access to both patients, relatives, but also partners that we collaborate with. So we see that the nurses has a huge interest in providing, for instance, virtual meetings. It's patient information, access to patient information. It is podcasts. It is video. And we have seen that grow during COVID, and we are fighting very hard to keep this momentum and kind of work harder to take it to the next level. We also see that working with patients at home, what we can do is kind of use the patient's own data. So patient-reported outcome is a very big issue at the hospital right now. How can we prepare much better for the visits that we have with the patients using patients' own data? How can we tailor the pathways even better by using the patient's own data? And of course, we also see a change in workflow, both at the hospital, but also in between sectors when discharging the patients much earlier than talking about prevention and talking about care at home. We need to have a lot more access. We need to have a lot more help provided to the patient's own home. And we need to build upon that. What we also see is that we also need someone to support the patients very direct. And we also need someone to be kind of the ethical voice of the patients.
Yes.
And this is also where nurses have a very huge strength in saying, okay, what can we do for the patients and what is okay? Thank you.
Thank you. And Eric, now I just wanted to take a fast speed round with the four of you. So what is the most important thing you would like to get out of this model that you want to test in the Nordics? So I give you 1 minute each. So what is it that you hope to get out of this, and who does it help most?
So I would say what I want to get out of it is identifying those areas where there is benefit in defining compatible policy across borders. Our small and medium enterprises are struggling. I've heard this from many of them because they need to meet the criteria of individual member states, which are all different. And so they spend more time actually writing RFPs than they do actually doing research. And so if we can actually get our policy structures to be more consistent across borders, then that actually will help our small and medium enterprises and will actually help our speed of innovation. Ultimately, and this is what the magical part of the Nordic way is, it's all about co-opetition. Cooperation on the things that are foundational and to allow competition in the areas where you want to actually define your best services. Health tends to actually compete on absolutely everything. And so this is where I'm hoping that through the work with the Nordic Council that we can actually create and foster what does co-opetition look like from a policy standpoint.
Thank you. Lars.
Well, first and foremost, it's actually that we use the principles of well-being economy to also have that as a driver for our well-being communities. Meaning specifically that in the Nordics that we move away from an approach towards that well-being, that it doesn't happen by default, that it happens by design. Mm-hmm. It means that we have to actually build also elements where we become much more serious about our ability to work together, that we look at how those elements come together so that we build trust by design, measurement and strategy. Mm. It requires a little bit of courage and commitment, of course, but it's a method that builds health by design and not by chance.
Thank you. Clayton.
I don't ask for much, so I really want to say that what I want to do is to change a mindset. Mm-hmm. I would like that this initiative really challenges us to think very differently about what we should be doing to keep our populations healthy and the need to leverage data for health to achieve that goal. If we even come close to considering what actions are required to get there, then I think this will have certainly achieved major strides for Europe's progress.
Thank you. Mette-Marie?
Yeah, so I think the focus is, of course, for us, increased quality in healthcare to all our patients. It's access to high quality care. And what we would like to see more is the support to our clinicians to have closer collaboration across the borders. Some of the areas could be a more distinct focus on rare diseases and a higher collaboration around that. And that is, of course, building communities around that.
Thank you so much, and thank you to these 4 very, very capable and good and strong panelists. I'm very honored to have you here, and thank you for your contribution, and we will keep on our collaboration going forward. Thank you. So this was the first panel on the bigger picture, where we heard different parts on how important it is to work together, both on the macro level, so on the WHO and OECD, also on the community level, and also quite clearly from the hospital side in this. Core element here is, of course, that we need to walk together, not to walk alone. And the last point from Clayton, I think I need to repeat, is about changing mindset. We will not do the things we dream about if we do not change our mindset. So now we are moving into the next session on Nordic practical challenges and solutions seen from a Nordic view. And with me here in the studio, I have Jesper Grønbæk, who's the founder and CEO of Copenhagen Health Tech Hub. Also, I have Diana Arcevic, who is CEO of Danish Life Science Cluster and also of the Lighthouse Life Science. Was that right?
Perfect.
Yes, thank you. And online with me, we have Malin Eklund, who is the program manager at Vinnova, the Swedish Innovation Fund. And also Anna Adolf Krag, who is representing the National Board of Health and Welfare in Sweden. So these are all 4 persons with vast experience in health and also in digital health. So if I start with you, Malin, you are a program manager at the Swedish Innovation Fund, and you have been involved in quite some different initiatives in Sweden, in the Nordics, and also in Europe. You've also been in the Nordic Health process since the beginning in that part. And you have been quite involved in the European genomic initiatives, for instance, which also requires a lot of data use. So what are the goals that you see in these different initiatives where the Nordic approach actually is a strength and can help?
Yes, thank you. It's really nice to be here, and very insightful comments already, where I think one of the main messages is that we are actually in agreement that what we want to achieve and why, and the urgency to achieve it. So my experience from different initiatives on a European level and also on a Nordic level is that there's really good starting points that need to somehow converge now in order for us to really take the steps forward in order for data to be utilized in such a way that it gives evidence, it supports each individual to live a long, healthy life, like you said, Bogi. And I think from my experience with the 1 Million Genome Initiative, for example, what we decided there in that member state group was that we need to work towards a common framework. So we heard about, interoperability layers that we sort of need to agree upon. But in addition to that we need also to generate high quality data according to international standards, according to procedures that actually give us data that we then can analyze and that gives us the information that we can act upon. So I think that's one part. And the Nordics could here be one of the test regions in order to showcase how you can collaborate across borders and utilize data from a larger data set. So this is where the time has come, because we do have a lot of good initiatives in the Nordics that we could merge and really find a common path forward so that we can achieve bigger things than on our own. And this goes, of course, then with the European Health Data Space that helps us now to move forward. But there's more work to be done. And here the Nordics could be one actor that can really support and facilitate this path forward.
Yes, thank you so much, Malin. And now going to you, Jesper. So one of the things that Malin also mentioned there is to have like an inner Nordic, how can I say, fast track on some of these things, which we also have set on as one of the things for Nordic Health going forward. So you are I would call dynamic entrepreneur who brings startup ideas both to the European and the global audience, but you are also based in Denmark, in Copenhagen, because you also see a value in that. So where do you see the value in Nordic collaboration and the dynamic that we have here?
Yeah, as you said, we have tried to accelerate the health tech ecosystem the last 6 years, and we see a lot of progress and we see a lot of momentum in each country, but also across the Nordics. And I think there's a lot of potential in making the Nordic region of a more cohesive region where we share data better and where we also sell and implement solutions better across the Nordics. Because if we do that, we also have the ability to actually export or help solve some of the real serious issues across the world.
Very good. And you, I think one of the examples I just want you to elaborate a bit on, which is very atypical, is that you have invented an award for the best implementers.
Yeah, that's right. Yeah. We have something called the Hermit Award, and that's because we believe implementation is key. And we also believe that there's many startup awards, even though that we breed and help startups all the day. We actually want to have an award where we actually put people on stage, the people who have actually taken the chance and actually chosen a new innovative solution and actually implemented it in a successful way. So we want to praise these people who have taken the chance and want to tell these implementation stories across the world, because we need more and better implementations.
So that's walking the talk of from what to how, you could say.
Yes, thank you.
And Diana, you have been in charge of joining the different life science clusters in Denmark and also with this lighthouse idea in Copenhagen. So what are the key life science opportunities you see in the Nordics?
I think that we have a strong position in our trust in our society, that we are capable of using that trust to collaborate across sector line borders. And in this, the possibility of building partnerships to drive innovation even further. I also think that we have a unique tradition within design, design where we put people in the center to really understand that health care is not just about hospitals. Health is about life, and humans, they travel abroad across sector borders. So to create platforms where we can really have every angle on the challenges to collaborate to solve them, I think this is a typical Nordic approach, and that's a strength position that we can bring into even broader collaborations.
Very good. And I think whatever you do looks like it's all about bringing different kinds of things together in some kind of a network.
Yes, it is. I'm very people focused. I think that every challenge has different view or angles to how to be solved. And I think sometimes when we get into the silos, we get blind to what's really at stake. So if we put our heart into a common mission for our citizens and patients, we'll see completely different possibilities. So to create larger insights through bringing people together, I think that is a key to drive innovation.
So I think if we take both of you on the Hermit and what you're talking about here, it's also to be really clear on that technology is one thing, but how you use it is really important. So Anna, you are with us from Sweden as well. So you have quite some experience both from the public and the private sector, which is also of course very necessary and something that is happening in the Nordics. So what in your experience are both the bottlenecks but also the the strengths in the Nordic when it comes to working with innovative solutions and interoperability in this way, and do you have an advice on how we do it best?
How we do it best? Well, I guess I'm representing the government here, so I have that perspective. I think one of the hinders is that the Nordic region has been a driving force in this for a long time. We've been legislating data for a long time, but that's also a hinder. It means, Eric mentioned, we need to change perspective and we need to change, and change is difficult, especially when some bits work. So that's been our biggest hinder, I think, and there are different reasons for it in the Nordic countries. But in Sweden, we have a regional sovereignty that makes regions decide on healthcare. The government doesn't implement, we just write frameworks. And that had to change, looking at the new needs, or not new needs, but digitalization introduces new ways of looking at the needs. And many of us have been into it. Collaboration is key. What we've done, and I see this in multiple Nordic countries, is that we work more on collaboration. So the regions in Sweden, for example, they're collaborating more, they're pooling their resources to make sure that they are doing things together, which means implementing it similarly. And this will give us stronger steering when it comes to implementation. And when I was on the private side, it was a struggle for me because we were supposed to respond to procurements that were not specific enough, which means they're different all over the country. So from a national government perspective, we need, and we're working on this right now in many of the Nordic countries, we're working on being more clear on what actually is required to reach interoperability, to make sure that data is available, both from a secondary perspective, but also for a primary perspective. Secondary has been the focus from the government side for many years, and this needs to change. EHDS is, of course, one big driving force, but we knew this before, and we started before. So the train is rolling. But I think collaboration, that's key.
Thank you so much. And I think this is a good way to go back to our other Swedish power woman that is with us here, Malin. Your focus has been very much on the genomics, and of course I've been very involved in genomic in part of my life as well. And in the genomic, in the end, something is about the aggregated knowledge, but very much is about the specific person and how we become more precise. And in the Nordics, we do both have a welfare approach, but we also have a protection approach, but a lot of data that we can pull together. So how do you see, not the bigger aggregated picture, but more how do we use this to get and help the individual person better?
Yeah, good question. Yes, I've been focusing a little bit on genomics, but I think that had to do with initiatives had to have a starting point, and that time genomics was sort of in a focal point, and to get political drive and investments, you sort of started there, but the aim has always been precision health, that this is one of the components that can guide an individual how to live, healthier life, but also to get support for treatment early on. So I think this is important to understand. So when we have genomics initiatives, I don't think we are not happy, having the genomes. We need to have the other data sets, of course, in order to really utilize information that can guide treatment, but also prevention for the individual. So I kind of like to see it as, like you also do, a system for health. We need to create a system for health where the choices and the good choices are easy choices. It means that you're not forced, but it's there. You can buy good food. You can exercise. You have good environment around you. But in order for the society to support that kind of system, we need then the biology, so that we can see your risks, but we also need to create the environment around the individual in a good way so that you can exercise, you can have clean air and so forth. And you also need to look into the behavior and cultural aspects of the individual. So yes, genomics has been a focus, but I agree, if I understand your question correctly, that, I mean, this is just a starting point, and then we really need to build the system that utilizes data in an efficient way.
Thank you. And Jesper, back to you. A lot of weight on your shoulders because we are waiting for the innovation in this part. Yes. So Malin was quite clear on that there are many aspects that we need to bring together, and knowing you, I know that you are thinking about several of these things. Yeah. So where do we start? What is the low-hanging fruit here in order to get going? Yeah. Because it is, as Clayton said, we need to change mindset.
Yes, I think that's a great question, and I think actually, having followed this space for the last 6 years in detail, I actually think the lowest hanging fruit is to implement the great stuff that's already there. Because there has been people out there across the Nordics and across the world that has spent the last 10 years developing some really good solutions, some really good AI solutions even, and other technical software solutions that can scale across the world. And now it's about actually putting the right incentives in place. Yes. Incentives to buy them, develop them, or implement them in a good way, so the healthcare staff actually can see, well, their burdens, their shoulders are falling down, because this is helping themselves, this is helping patients and relatives and others.
And is there any specific thing that you personally would like to just push on this?
There are many things, but I think I want to have, personally, I would like each government across the Nordics to actually think about, hey, how can we make the Nordics, how can we not only think, because many politicians in the Nordics and across the world, they think about what is healthcare for our voters, so we can be re-elected. But actually, I think healthcare in the Nordics, we have an obligation to make healthcare not only for the Nordic people, but for the rest of the world.
Okay. So it's really about helping the many.
Yeah.
Very good. Diana, you are a power woman of networks.
Yes.
And you see a lot of different dynamics in it. So if you could choose, and you can here, where would you like the strategy to focus most on these parts? Because we can't do everything at the same time.
Well, my brain is just wiring on what Jesper said here, because I think implementation is key. And I think, Malin said it, I think that we have been countries of test platforms, and to move beyond that, to really create impact, we need to be better at not just testing, but really implementing. And having the incentives to take those risks, I think we'll have a need models where we kind of share both risk but also gain possibilities, that the really good actors here in the ecosystem to scale things are not necessarily the public sector. So let the procurement models include scaling and implementation with the stakeholders outside, being the private companies or even collaborators in communities. So I think having a network strategy that allows more risk when you have the agreement on really changing and innovating things. I think so many times we are thinking that we can solve things in our silo, as I said before, but I think this is where we really need each other.
Okay. Thank you so much. And Anna, back to you. So if we then think about where you both have a long experience both in the public and the private with innovation and application and implementation in this. So I will start with you and to push a bit on, so what is it we want to help the end user or the citizen, the person with? So what do you see as just one of the things you would like to see work for the citizen in, let's say, 3 to 5 years from now?
Oh, God. I think the European Commission says we want the citizen to be engaged in its own health. And one way of doing that is introducing them to own their own data and influencing that data. I think we have a responsibility to look at it as an ecosystem where we're all stakeholders that are supposed to collaborate, no matter if we're on a very local GP level neighbor, but we need to talk about health not as a disease, but as a prevention. So a difficult question offhand, but I think many of us have been onto it. At least the collaborating way goes down to each individual. And we have patients that are more active in their healthcare, but we also need individuals that are more active in their health in general and well-being.
Okay. So you could say reducing the avoidable disease burden by giving tools in a certain way.
Yeah, and sharing the problem. So we talk a lot about who's the problem owner. And in this case, I think we need to share the problem and dividing sort of the burden of solving the issues.
Okay, so thank you so much on that one. Now I want to have a fast round with you. I want to have a response on when you get very inspired, you get home after 2 days interaction. What is it that you will start doing tomorrow, which you're not already doing, that speaks towards this better health and where we engage the person, we help the individual? What is that single most important thing that you will start with tomorrow? Diana, do you want to start?
I think actually building what we do now in Denmark, network across the sectors more internationally. Mm-hmm. We do attend the EU projects where we have the chance to collaborate across borders, but listening to all these amazing speakers here, I see the potential maybe even bigger, and to get the insights and data on the challenges that we really have that are so common, to think of them in more global scale, and maybe unite the European market a bit more.
Thank you. Marlon, could we have you in now?
No, I like the words of implementing. I like the words that we need to implement what we have. So I think one key is actually start implementing, and we need to learn as we go. We generate evidence, we generate trust, and we lower sort of the risk and for implementation as we go along. So let's do that, implement what we know, and the Nordic region can really be a driver here.
Thank you. Jesper?
Yeah, as I said, implementation is key, but we're actually not very good at implementing digital health solutions across the world. So I would like to start tomorrow by actually doing a little bit more research, or finding the researchers across the world and finding out who's actually best at implementing digital health solutions. And how can we learn from them, and how can we develop a framework and a method which we can help across the WHO region and actually say, hey, for this specific solution, these type of top two frameworks are the best solutions to choose. So we need to make it easy to implement well.
So we need to mass produce good hermits.
Yeah, kind of.
Implementation.
Yeah, kind of. Then we can close down the board.
Good idea.
Very good. Anna.
Yes, I think Jesper and I think alike. So from my perspective, communicating best practices. So this is something we've talked about in the WHO partnership program. How can we share the best practices from those countries that have done it, not the ones talking about it? So increasing that and communicating it more clearly.
Okay. Thank you. And I just would like to, now I have your network champions here. So we have so many initiatives on a global level, not enough on a global level, but a lot of European level and also on a Nordic level. And you are involved in several of them. So what is the key thing to get this to really, really synergize together? Is there a secret sauce?
I don't know if there's a secret sauce, but I think collecting the powers of the networks in the same direction, so get the same missions cleared, so that we would have strategies, a little bit like COVID, like a really sharp focus to bring all our powers in one direction.
Okay. Jesper, do you?
I don't think that, unfortunately, there's no secret sauce. No. But there's a lot of hard work. But there's also maybe some courage as well. So maybe the secret sauce is courage. Courage and incentives.
Okay, Malin?
But I believe that mission-oriented processes could actually work, because that means that you have a common vision, you have common paths moving forward, and you have a division of labor and responsibility that gives the community a focus which can drive change. So that could be one tool for us to increase the progress we are doing.
Thank you. Anna?
Being better expressing the needs and prioritizing in between them, because we all think that our need is the most important ones, but we need to collaborate and discuss which one is actually the primary one and should be the patient, but that's not always the case.
Or maybe also the person before they become a patient.
Sorry, fair enough.
Thank you so much for this very good second panel. I'm really honored to have all of you here, and having these networks capacities, the future is bright, because now you are on the internet. You will always be there, and we need to walk the talk in this way.
Yes.
Thank you so much.
Thank you.
So this was the end of the second round, and I think what we really heard here is about the good choices. It's about the networks and bringing that together. It's also about precision health being important, and also that implementation is really, really key. We need to have the courage to do these kinds of things. So with that, we are now going to the third panel, which is focusing on connecting Nordic data and values to advance Europe. So with us here we have Marianne Pilgaard, who is the director of Trial Nation. We have Lars Lindskjold, who is president of the European Federation of Medical Informatics, also called EFMI or EFMI, and board member of the Center of Transdisciplinary AI at Umeå University. So we don't really know if he's here or it is an avatar, right, on that part. And then we have online Line Lindstad, Senior Advisor at Norwegian Center for eHealth Research. And we also have Nard Shores, who is the Managing Director of EHIN, so the big Norwegian eHealth conference, and also Nordic in that way. So thank you so much. And starting with you, Marianne, you have built a cross-sector concept, again, collaboration, on clinical trials in Denmark. And is that something that you think should be pushed to a more Nordic and European part?
Well, I think that's quite a leading question, but I do agree, actually. I do believe that having a national clinical trial structure which reflects the healthcare system is of utmost importance. And we have seen that, for instance, during COVID, how important it is to be able to very quickly react on health issues. But it's also in a more preventative fashion, because having interventions that you know are scientifically sound is very important. And it's also reflected in the WHO guidance paper, which was released just a few weeks ago.
Yeah. Okay. And just to push you a little bit on this, what the Trial Nation is about is really to get all the stakeholders together, all the relevant stakeholders, and there are ongoing meeting to learn and adapt and listen to frustrations and learnings.
Yes. So making sure that you engage all the stakeholders across the clinical trials ecosystem, that's a good way of making sure that you have good trials and that you get something which is relevant for all parties. And you need all parties, again, the collaboration aspect, in order to create sound evidence.
Yes. And the sound evidence is, of course, so we can provide the best treatment for patients who need it.
Yeah.
Very good. And Lars, so you have focused most of your professional life on health informatics, and you also have European leadership role. So how do we use this Nordic way of thinking to provide alignment at the European level?
The Nordic way of thinking, yeah, you can think about that. One of the things I've seen the older I get is how this concept about digital actually doesn't have any borders. Anything can be everywhere, anytime, and so on. And I'm also fascinated of what we are talking about, the data points by themselves. What do they really mean, and what can they do? And I think one of the major problems I've seen from my healthcare perspective is that we don't see the difference between information and healthcare and data points. And that's really difficult, because if you think about the future as we see it as per today, it's the data point that can make some type of information that is needed. And I'm quite sitting listening to the other panels here before. It has been amazing to see how good thinking it's out there. And the problem is, for me, is to understand not only to have knowledge, but how to use knowledge. That's really a tricky part for us. And there I think informaticians can play a role in the future. I used to say, when people ask me, what do an informatician do? I say, well, he do it better for more, and then I stop.
Yes. Very good. Thank you so much. And Lina, who is with us online. So you have worked quite a lot on the digital health and the Nordic welfare model, how that interacts, because we are changing our social contract, so to say, when we lose the borders, as Lars was saying, or a part of it becomes borderless. So how do we see this in the Nordics, and why is this important in your research that you have been looking at?
Well, my recent research, or the last 3-4 years, I've been looking into the concept of national governance models in e-health, and what is the features of the governance models in the Nordics, what's so special about the Nordics and our welfare states, and how we govern e-health and implementation of e-health, and even implementation of incentives, which were talked about in previous panels. Well, I've found that the governance models are very inclusive. The tradition in the Nordic countries is that we have a very short distance to those who govern us, to the politicians, and we have high trust in our systems and our health systems. So we require that we are all engaged, and that we are all included in the national processes in order to realize the policies on digitalization, or as we are talking about here, e-health. But including making governance models which are inclusive also entails including all the different stakeholders, which all are autonomous actors with their own decision system, their own policy views, their own interests, so to speak. So you need to have some patience. The government needs to have some patience. You need to include them, but we also have to run processes which are, when we're able to negotiate as far as we can get in order to realize the goals which we have set for us. And at the same time, these governance models do also need to be transparent. So we need to have a system, a governance model which has a transparent decision system, which also then build trust in the governance model. If the government is trying to push forward the policies more quickly than the stakeholders are interested in, then they will lose interest, and they will sort of bypass the ideas of the government. So that all stakeholders need to be patient with each other. And in recent political science theory, the researchers of the theories, they say that use the concept of co-creation, and co-creation is a concept which is it's used a lot in many different sectors today, I guess. But the thing is that co-creation means that maybe we could find models which work in parts, and then they can learn from each other. So we don't have to force consensus we could walk to talk, and we can try to reach it by going steps back and forth and together.
Thank you. And now to you, Nard. So consensus and bringing people together, and what Line also says is that if you really want to go far, you need to walk together, as we were saying. So you run one big e-health conference. You bring a lot of stakeholders together. Yes. We have also worked quite a lot together for many years on the Nordic Health, and there is a Nordic track also on EHIN, even if it's a Norwegian conference in that way. So why is this important to you?
So EHIN, which stands for e-health in Norway, it could also stand for e-health in the Nordics. One of the basic concepts is that we look to the future of healthcare and try to find out who are we going to involve there. And we see three groups which are very important. That is the ICT industry, the tech revolution, because we are in the middle of a tech revolution, which we have seen change banking, traveling, logistics, and so on. We have the healthcare system with the hospitals and municipalities and the home care. And then we have the policymakers and the politicians. So if you bring those three groups together and let them discuss openly on the future of healthcare, you might have a chance we get the right solutions. I don't say you get the right solution, but I would like to say if you exclude one of the three groups, you will definitely not get the right solutions. So in the Nordics, we're all small countries, and as we know, 7, 8 of the biggest companies in the world are ICT companies. So if we want to do anything on digitalization, we have to think big. We have to think bigger than just Norway, Denmark, Sweden, Finland, Iceland. We have to connect. And as we have very similar values in our society, it should be easy to make that connection.
Very good. So that connection across the country is both in order to be interesting for bigger solutions, but it's also to have a bigger home market to be able to develop some things, I assume.
And of course, innovation in the Nordics is expensive. So if we want to bring down the cost, so we can also offer this innovation to the rest of the world. Yeah. We have very high quality healthcare services. We have very high quality digital services. We have good societal values like trust has been mentioned many times today. So equality, space and human-centered digital solutions. If we can build that into healthcare and we want to share that with the rest of the world, we need to scale up.
Very good. Thank you. Marianne, back to you. So, of course, you are working with clinical trials and with this model. My question here, also in the Nordic spirit, is why is it so important to have clinical trials as a part of building a sustainable health model? So both for the resource use, but also to bring the best possible service to the citizen.
Well, I do believe that clinical trials is one aspect is, of course, developing new therapies, but it's also about having the right interventions and testing if the interventions work. And in order to do that, you may also need to test what's already in place, and you may need to test also preventative interventions to see if they work. In clinical trials, that's a basic way of providing sound evidence. And again, coming back to having multiple stakeholders connected, making sure that you create the right basis for trials is essence.
And here I'm assuming, now you have to correct me if I'm wrong, but the data richness in the Nordics
is vast.
Gives a different opportunity with real-world evidence, real-world data, and connecting different parts.
Yes, I would say that having longitudinal data, data of all different aspects of society, both health and socioeconomic data, it has a data richness which is fantastic.
Very good. And Lars, you have of course also worked quite a bit with data and how we can work this in different ways. So what if you take one or two of the most important things which we can spearhead, maybe we do, but which we should spearhead more in Europe, what would that be?
I would like to go to Marianne.
You're welcome.
I'm always fascinating over the difference between evidence and implementation, and what evidence really means. And for me, evidence obviously is based on a group perspective. That's why we're doing clinical trials. So we say that this might work for this type of care or diagnosis. But now we are suddenly also talking about the individuals. We're giving them more power. When we say we talk about personalized medicine and so on. And there we have and will have a little bit of a problem. And my question to my outstanding panels here is, do we think that knowing more of each individual could mean that we could understand them more? So we could start to do the right things for you or for you. That's a really tricky thing, because we are not trained to that. We are trained on evidence. We are following the group perspective. We are doing what we should do regarding to the process and so on.
So what I hear you say is what we really need to rethink on predictive models and also precision approaches both to health and medicine, we probably can do very good in the Nordics, but it actually requires that we have the courage to rethink how we do this. And I see Mariana is nodding.
Yeah, it's such an interesting concept, and I think that we do see that a lot of the new interventions are very much looking at very highly targeted populations. And of course, if you can leverage the data richness that you have, the likelihood also for finding the smaller groups where this same applies. So you're one within a specific target group, together with more predictive approaches, which might not be a clinical trial, but using other aspects, would be excellent supplements. Yeah. So,
Line, back to you. You, of course, are looking very much from a societal or political science point of view on these things, as you were explaining beforehand. So you were coming in your first intervention on the direct interaction with the welfare state and how we look at consensus. But here we are also getting new aspects in which to a part of the society would be controversial until we like them, like so many other things. So how do you see that? Because if we want to, as Lars was mentioning, to go from the evidence to the direct individual and maybe to the predictive, we still need to have a social contract that we want to do this, because we still need the aggregated knowledge in order to go individual. So how would you see that from your more political science research side?
It's a good question. Traditionally, assessing the implementation of e-health services, we have had RCT as the gold standard. And the governance models today are sort of running along with that kind of concept and that way of understanding the world and how we govern this. I think, and this is something just I think, it's not something which I have any knowledge about, but this is something which I would like to go much further dig into, and that is, how can we tailor our future governance models so that that the private and the public sector work closer together, and that we bring research innovation closer into the daily activities of both the health system, but also in the system which is tailoring individual prevention active or services. And that's something which we really don't have any knowledge about today. But I think that we need to get together and make inclusive models in a different way, because we have to do. I really liked what you said, Eric Sutherland, about collaboration and competition. We need to sort of build our policies and how we catch the individual and the group and the national and even the regional level, which the WHO is representing. We need to catch all those levels at the same time with governance models that are connected. But at the same time, they have to be built on the dynamics which comes from collaboration and competition. And I think one of the main ways of getting there is to understand that we need to work together, public and private sector. Do I have time, Bogiv, to have an example?
Yes, 1 minute, please.
Okay, it's just about when we introduce AI technologies today in the health system, in the Norwegian health system. Today, this is being done in every hospital, and it is not done on the national level, and that entails a lot of resources being used for evaluation of those apps, which are actually being used today in Sweden and Denmark at the daily basis. So we need. It's just an example of how we need new governance models, which makes us implement and take into use the technology which is already ready and which is used in the Nordic countries today.
Yeah, thank you, Nard. So you have created the meeting space for Nordics. I could say I think it is the biggest meeting space for digital health in the Nordics, and I always learn a lot when we are in Oslo those days in November, meeting new people on it. And when you hear these different parts of it, and you are also very good at taking provocative speakers in at times as well. So what do you think is the core that a meeting space like yours should do with this dynamic?
Well, I think we have to first understand that there's a lot of talk about data, it's about AI. Those guys and girls who know this are mostly working in the ICT industry. They know how to collect data, how to store them, how to share them, how to analyze them, how to make value out of it. And the tech revolution is going really quickly. We're in healthcare a little bit behind, but it will hit us like a big boom. So technology is value neutral, so we can use it in a good way or in a bad way. And I think if we want to use this new technology, which is coming very quickly toward us, in a good way within healthcare, we need to cooperate. We need to bring the people together and bring the Nordics together to make a stake. Together we are like 27, 30 million people. We have a lot of good knowledge, but it's very fragmented. There's a lot of good innovative environments. It's very fragmented. And as Line also said about there are a lot of every hospital doing its own thing. We have to connect the dots. We have to bring people together, understand the tech revolution, and how can we connect it to our societal values, keep them in place and build them by default into the digital systems we are going to create in the Nordics, and then we can also offer that to the rest of the world. And I think we really have to understand that if we don't start now, we might be too late. And we have seen that with news and internet, like big players taking all the space because we were thinking we could handle it, but we couldn't. So now we have to be there quickly.
Thank you. So that comes back to one of the things that we have discussed quite a lot in the Nordic Health work is can we create a common playing ground that we agree on? And of course we need to work with the big tech players, but probably we also need to say what are the terms to come in here, so you also get the data value back into the society. So so if we then go back to Marianne, you with more focus on the trials, but trials in the future, most people just think about medicine trials, but there are probably going to be many different trials in that way. And just to take one example, and this is because I've been working so much with this the last year. So in Denmark now, on the new health reform, COPD has been seen as the first target on chronic disease to work with, and we have just launched a COPD index. So of course that's something which I've digged a lot into. But this is also a silent disease, even if it's the third biggest killer in the world, but it hits the weakest part of the society. It has not really got an attention. So this way of trials and knowledge, is there also a way where organizations like yours also should maybe think about, okay, are there things we are not really seeing that we should focus on, since you sit in a center spot
Yeah,
like that.
I think that you're pointing to something which is extremely important, and of course it's the underrepresented populations, and also how you reach every individual who could benefit from participating in a clinical trial and making it possible for them to participate. And I do think that in the health reform there is also a strong focus on digitalization. That has been a trend also from previous work, but it's really pronounced. And I do think that marrying the a decentralized clinical trials approach, meaning making it possible for the patient to participate in the trial on their terms, closer to home, which may be at home, which may be really crucial for many patients to do that. And that is something that we are also working on in Denmark. And Denmark was also, as a case, the first country in the world to have a guideline where the authorities developed a guideline on how to do decentralized clinical trials.
Yes, thank you. So, and we from the Institute are of course involved in the phase 5 study as well. So, and that comes back to several of your points, Lars. On so how do you get the trust? Is it about a new way of thinking transparency and traceability on data? Because what is holding us a bit back is a very paper-based privacy logic. And not really a dynamic on how do we use data, because one thing is to protect data, but we really need to protect persons, and sometimes we actually need to activate data to do that. So how do we, in a trust-based system like the Nordics, how can we move forward and get the use to be better?
If I knew the answer of that, I wouldn't be here today. But it's really,
or you would be here alone.
Or I would be here alone. But it's obviously something that is very important for mankind is the trust.
Yeah.
Okay. That's something we are born with. It gives us the security around us and so on. Driven a lot from political things and so on. And what we see today is, I used to talk about the ontology crash. We don't have words to explain what is happening. We don't know what AI will do for us. We don't know where our data is and so on. And it's really difficult for mankind to feel secure about this. So I used to say that probably the best way to continue to build trust is to accept to make mistakes.
Yes, that was a very good one. Line, so I'm very happy with that. So with all my mistakes, I'm forgiven. So shortly from your side, you also mentioned trust in the beginning. So what are the maybe 2 or 3 most important pillars of trust that we know from the Nordics?
I cannot hear you.
Can you hear me now?
There's no sound.
Okay, I'll take Nard first then.
Nard, something has happened to the system.
Nard, you of course have been focusing on the digital side of health for many years, and you have also talked about the private-public partnership in these ways. And we have also talked many times on how do we get to the next stage. And with all these interactions, all the stakeholders you were talking with, Norwegian, Nordics, European, global, where do we start?
Where do we start? It's an interesting question because, you know, we talk a lot about data, and we know that data can help us with diagnosing and also treating us, but it can also help us to not get ill, to work in a preventive way. And a data-driven system can help us very much. We see that we have to change healthcare because we're too much focused on helping people when they get sick, and we have to help them more not getting ill. Yeah. We have to get started with changing our mentality. I think that it's slowly happened. I see politicians and other people who are there who say we really have to change the system, but it will take some time really to work there. But I think to change the way of thinking is the first step we should do.
Okay, thank you. And Line, now you are back.
Yes, sorry, Tromsø was left out for a while. Well, I think that we should focus on getting more knowledge about how we build future inclusive models, governance models, which include everyone.
So you trust the system, so to say. And
yes, to build trust, of course, and to maintain the trust we already have, because it's always endangered.
Yes. So now we are getting to the end, and one of the things that I've personally have been pushing quite a lot on this agenda is that we are spending a lot of time on discussing privacy, but we are not really spending time on discussing how do we make it so that privacy doesn't matter. So how do we make it so that whatever you share of data cannot be used against you? And now I just want a very short answer because we don't have much time, so 30 seconds each. Do you think that is possible? Can we in the Nordics sit together and say, okay, this is the single thing we do?
Well, from a technical perspective, I'm thinking of another project which is run in Denmark, where you can put data in, it becomes completely anonymized, but can still be used for the greater, better good.
Okay. Lars?
Synthetic data might be something that we can put trust in, because if it's synthetic, we can say it's not me.
Very good. Nard?
I think we need a strong set of rules how we treat the data, but we might not be able to keep them safe forever.
Okay, thank you. Lina?
I think that you will never get to a situation where there's zero risk.
Oh, that's true, and that should be what we work out from. So thank you so much, this fourth panel. I think this was really good. I'm really happy and honored also to have you here. I've been very, very, how can I say, blessed with being able to host a webinar which is filled with my heroes on a daily basis. So I think we have heard a bit about the ideas with Nordic Health, which we started in 2019. It was established on a question about how do we go forward when the world moves from being analog to being analog and digital? And what does it do to the cohesion and societal contract that we need to deal with? And we have discussed several of these things today. But it's also really about where is it we want to go? And that was the purpose of the first year of working in 2019. What is the goal? And that led to many of these values that we have put into Nordic Health. Then we thought that we would be working slowly forward, and then a small bug came in the way, COVID. So we couldn't really continue as we thought, but of course we became more digital and worked in that way. And last year and the first part of this year, we did the second part of bringing people together and working on this part and really labeling it from the what to the how. So having a direction that we more or less agree on, we don't have to agree 100%, but 70-80% is fine, but walk in the same direction and really being concrete on small steps, big steps, but getting going, implementing what exists that we heard from many of these. But there is also a very important part here, that's imagining the future that you want. The future is not given. There are parts of the future that can be shaped. There are parts which are outside of our control, yes, but there are parts which we can shape and take control of, and there are partnerships that we can choose to be part of in order to do that. And that is the real core of the Nordic Health that we want to push forward. And we are much more than Nordic. We are happy to work around the world, and this focus is on Europe. So if you're interested, please stay in touch or contact us and to see how we can work in your with you and your country or organization in that part. And I would like to thank Clayton Hamilton a lot for setting this up with the WHO European Office. I would like to thank the fantastic panelists, the 4 we have now and the others that we had before. Of course, a huge appreciation to the CIFS team and the many collaborators, and especially those, of course, in and around Nordic Health, but also the others around the world in this part. And let's just end with this world. If we really want to make the change, we have to walk together. Thank you so much.